Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdurrahim here with you. So from today we are going to start valvular heart diseases and our first topic will be mitral regurgitation. Although my plan was to go slowly like first to systolic function, then diastolic function and then move on to valvular heart diseases, but most of you requested to start from valvular heart diseases, although we are in very small numbers still, but most of you from those numbers are saying to start with mitral regurgitation or valvular heart diseases. So from today we'll be starting mitral regurgitation. I will be explaining about the mitral regurgitation now. Then in the next video I will show you the videos and I will also explain you on the pictures. Okay, so let's start from first about the definition. What is mitral regurgitation? First you need to know that the mitral valve is the valve on the left side of the heart between the left ventricle and the left atrium, and whenever we see any abnormal flow coming from the left ventricle to the left atrium, we call it mitral regurgitation. Okay, you can simply call leakage or backflow from the valve. Mitral valve is called mitral regurgitation, or a backflow of coming from the left ventricle to the left atrium is known as mitral regurgitation. So whatever way you want, you can define it. Next we came into the as a echocardiographer view. So whenever a patient comes with mitral regurgitation and you are having a case of mitral regurgitation, you need to mainly you need to answer a few questions into it. First thing is there a mitral regurgitation? Second thing is, how much is a mitral regurgitation? Third thing is, why there is a mitral regurgitation? And the fourth thing is, what is the impact of mitral regurgitation? So these all four questions you need to answer in every case of mitral regurgitation. Okay, so how you are going to do it? Once you go into the detail of it, then you will learn more about mitral regurgitation. So let's start from the first question. Is there a mitral regurgitation? This is an easy question. You put the color on mitral valve. If you see there is a backflow coming, you will say, oh, there is a mitral regurgitation. And then you can say, yes, your first thing is ticked and you are done with the first question. The next question is, how much is the mitral regurgitation? Now, this is the question where you need to quantify your mitral regurgitation. So how you are going to quantify your mitral regurgitation? Definitely, there are different parameters to quantify mitral regurgitation. The first thing in every case in echocardiography is the eyeball assessment, that you look at the jet. How big is the jet? Is the jet filling almost more than 60% of the left atrium? Then you call it like, okay, I'm not talking about that you need to measure it to get a 60%. No, it's just about your visual assessment. If you think that there is a lot of mitral rigor, the jet is going till the pulmonary veins, it means there is quite much of mitral regurgitation. Okay, so this is your first thing, eyeball assessment. So you will look at it in different views. Okay, long axis, then you can try in short axis as well, then 4, 3, 2, you will get an idea that how much is the regurgitation, which with the color. Keep an eye when you are assessing the mitral regurgitation, you need to keep your color scale around 60. Okay, 55 to 60 or 65, so in between this. Your color must not be very low that you are overestimating your mitral regurgitation. And if you are using, for example, GE machine and your gains are very high, then even then you are not going to get a proper regurgitation. I'll show you later on in the machines that how you can make a severe regurgitation to mild regurgitation only because of the machine settings. Okay, but that's a later thing. Okay, so that's one point. The other point is that you can do the quantification by doing the PISA method. Okay, you get the PISA parameters, all the parameters of the PISA method, and then you get the mitral regurgitation ERO, okay, and regurgitant volume. You can get the regurgitant volume by two ways. One way is by ERO, like you get the ERO, okay, by PISA method, and then multiply it with the mitral regurgitation VTI, and you will get the mitral regurgitation volume. The other way is to get, like, you get the mitral stroke volume and you get the alveolar stroke volume. Okay, and then you get you minus from the mitral stroke volume, then you take out the alveolar stroke volume from mitral stroke volume, because there is more flow going from the mitral valve. So you will keep mitral valve minus alveolar volume. So for example, your flow like 100 is going from, you calculated mitral stroke volume as 100 and LVOT stroke volume as 50. So it means the other 50 is your regurgitant volume. So this is how you are going to do it. So how you get the stroke volume? Stroke volume, whenever you want to get a stroke volume of any area in echocardiography, you will use a formula of cross-sectional area into VTI of that particular area. So cross-sectional area has also its formula, which is pi r square. Okay, so you use this formula and you get the measure the annulus of the mitral valve and also get the LVOT diameter for LVOT stroke volume, and then you get the VTI of mitral inflow and also the LVOT VTI. So once you will get it, you can get the mitral stroke volume and also the LVOT stroke volume. So this is another way to get to the regurgitant volume. The next thing is to look at the mitral E velocity, that how big is the mitral E velocity. I will explain you that why you are going to see this one, but just have a look. If your mitral E velocity in a native valve, native means like a valve which has no procedures done, okay, not a prosthetic valve. So if your velocity is more than 1.2, it means there is quite much of mitral regurgitation, and if it exceeds from 1.5, it means severe mitral regurgitation. And then the next way to look at pulmonary vein Doppler. You put the Doppler on the pulmonary vein. If the mitral jet is reaching till pulmonary veins, you will put the Doppler there and you will see systolic flow reversal. Okay, because mitral regurgitation comes in systole. So you will see, once you put the Doppler in pulmonary vein, so instead of flow coming forward to the left atrium, you will see flow going back to the pulmonary veins from the left atrium, okay, in systole. That is called the systolic flow reversal due to significant MR in pulmonary veins, okay. Or you might see the systolic flow blunting, like there will be almost a flat line when there is a systolic in the systolic flow of pulmonary vein. So these 2-3 things. Then definitely you need to look at the other parameters. The next question will come into it, like what is the impact of mitral regurgitation. So for the impact, you will look at the LV size, you will get the volume of the LV to look at if there is LV dilatation. Then you will look at the left atrium size, how big is the left atrium. Then you will get to the pulmonary artery pressure, that if due to congestion, because the flow is not going forward, so it's getting streamed backwards, okay, so it's staying into the pulmonary veins and lungs, so the pulmonary pressures are increasing. So you will see due to congestion, you will see pulmonary artery pressures goes up, okay. So this will also tell you that this is the impact of severe mitral regurgitation. So this was the impact. Then you need to look at the RV function as well. It also plays a very important role, because when the pulmonary pressure goes up, a lot of pressure comes onto the RV, so RV start filling up, but this is a later stage. So this was about the impact. One question I missed it intentionally was, why is there mitral regurgitation? This is the most important question to answer in echocardiography. Okay, if you are an echocardiographer and you are answering this question, well, it means you know mitral regurgitation very well. Okay, so let's come on to this. So if we talk about the etiology of mitral regurgitation, so there are mainly 2 types of mitral regurgitation on this basis. One is primary mitral regurgitation, the other one is secondary mitral regurgitation. So primary mitral regurgitation means like if there is regurgitation due to something wrong with the mitral valve itself, okay. So what could be wrong? Maybe a congenital issue with the mitral valve, a mitral valve prolapse, myxomatous valve, Barlow's disease. So these all come into the primary mitral regurgitation. And then rheumatic mitral valve. Then in the elderly age, maybe a calcified mitral annulus or calcified mitral leaflets can cause mitral regurgitation. So these are mainly issues with the valve itself. So when there is a problem with the valve, maybe a torn cordae or these sort of thing can cause mitral regurgitation, and these are the primary mitral regurgitation. Then we come into the secondary mitral regurgitation. Secondary mitral regurgitation is when you are having mitral regurgitation but the valve itself is fine. So there are issues with the other areas of the valve. Maybe the annulus is dilated. Sometimes what happens is that your left atrium and left ventricle are very much dilated, for example in dilated cardiomyopathy. So the leaflet itself are very good. They are trying to coapt well, but because the annulus is very much dilated, so they are not coapting well. So that's why you are having mitral regurgitation. So annulus dilatation, or sometimes the tethering of the leaflets, maybe left ventricle is very much dilated, so the leaflet gets tethered, so they don't close properly because the cords which are attached to the muscles, so the muscles gets tethered with the cavity, LV cavity. So these cords also get stretched out, so the leaflet doesn't close properly, so that can also cause mitral regurgitation. Then you can have patients with ischemia, like inferior wall infarct. Okay, when there is an inferior wall infarct, your posterior leaflet gets tethered with it. Okay, so you will get mostly the posterior directed jet, and you will have the posterior mitral regurgitation in those patients. So these are, and then there are different diseases as well. I will explain you in the next vlog when I'll show you videos and also the pictures. I'll explain you, but these are the main things you need to keep in mind. Okay, so these are all the questions, how you are going to answer them. I give you a hint today. In the next vlog, I will explain you more about how the mitral regurgitation looks like and how we should be quantifying it, and then what are the main causes as well. I will discuss it in the next vlog. Okay, thank you very much. Keep subscribing and please share it with others. Thank you. Bye bye.